Welcome to Medicare 360. I'm your host, Jennifer Lee. Today we're going to go over Medicare New Handbook, find out what Medicare covers. So we did leave off on page 34 on chronic care management services. If you have two or more serious chronic conditions like arthritis and diabetes that you expect to last at least a year, Medicare may pay for healthcare providers' help to manage those conditions. This includes a comprehensive care plan that lists your health problems and goals. Other providers, medications, community services you have and need, and other health information. It also explains the care you need and how it will be coordinated. So there are many that do have chronic care management that's needed. So mainly in Medicare Advantage plans, you see those with actually more benefits because you have a chronic condition. This year, on a side note, if you do have a chronic condition, they are very strict on making sure that you actually do. So typically, if they could verify it through your prescription drugs, they will. But if they can't, they will actually reach out to your doctor, and your doctor just needs to sign off on it that you do have that chronic condition, and it's a checklist. I would say your agent should help you out with that. This year, since they've been really strict, it's something that if you don't check your mail, they might terminate your plan because they can't find a chronic condition. But if that's the case, if they do terminate your plan just because you're on vacation and you didn't read it, you do have a special enrollment period to actually get onto a new plan because you don't qualify for that chronic condition. Your agent should be able to help you make sure you have that chronic condition, right? And also, if you really don't qualify, put you on a plan that has. Like I mentioned, these chronic condition plans, they provide a lot more benefits to you. Okay, so if you agree to this type of service, your provider will prepare the care plan for you or your caregiver, help you with medication management, provide 24/7 access for urgent care management needs, give you support when you go from one healthcare setting to another, and help you with any other chronic care needs. So sometimes people ask, what type of benefits? Just as overview, sometimes you get more groceries, more over the counter, extra help like a caregiver, or relieving your current caregiver. So things like that. You do pay a monthly fee, and the Part B deductible and co-insurance apply. If you have supplemental insurance, including Medicaid, it may cover the monthly fee. Chronic pain management and treatment services. Medicare covers monthly services for people living with chronic pain, persistent or recurring pain lasting longer than 3 months. Services may include pain assessment, medication management, and care coordination and planning. This Part B deductible and co-insurance applies. The Part B deductible co-insurance does apply. Clinical research studies. Clinical research studies test how well different types of medical care work and if they're safe, like how well a cancer drug works. For certain clinical research studies, Medicare covers some costs like office visits and tests. You may pay 20% of the Medicare approved amount, depending on the treatment you get. The Part B deductible may apply. So let's go to page 35. Note, if you're in a Medicare Advantage plan, Original Medicare may cover some costs along with your Medicare Advantage plan. Contact your plan for details about coverage for clinical research studies. Cognitive assessment and care plan services. When you visit your provider, including your yearly wellness visit, they may perform a cognitive assessment to look for signs of dementia, including Alzheimer's disease. Signs of cognitive impairment include trouble remembering, learning new things, concentrating, managing finances, or making decisions. Conditions like depression, anxiety, and delirium can also cause confusion. So it's important to understand why you may be having symptoms. Medicare covers a separate visit with a doctor or a healthcare provider to do a full review of your cognitive function, establish or confirm a diagnosis like dementia or Alzheimer's disease, and develop a care plan. You could bring someone with you, like a spouse, friend, or caregiver, to provide information and answer questions. During this visit, the doctor or healthcare provider may perform an exam, talk with you about your medical history, and review your medications. Identify your social support, including care that your usual caregiver can provide. Create a care plan that help address and manage your symptoms. Help you develop or update your advanced care plan. Go to pages 30 to 31. Refer you to a specialist if needed. Help you understand more about community resources like rehabilitation services, adult day health programs, and support groups. The Part B deductible and coinsurance applies. So what's new? Some people living with dementia and their family and unpaid givers may be able to get additional support through the Guiding an Improved Dementia Experience Model Pilot Program. Talk to your provider for more information and to find out if they participate. So I've actually been meeting people that has told me, I got some tests done and I'm actually going to get Alzheimer's in 3 to 5 years. It's pretty crazy, the technology that we have today. Just on a side note, I would just say loneliness, with that depression gives you actually a higher risk of like Alzheimer's and dementia. So just having the social aspect, especially when you're retired, going out and about and just having that social aspect, be it adult daycare or even if you're not that point, like there's a lot of senior communities. They have bridge, bingo, they have lunches, they have special events that are pretty fun and just gets you moving and, socializing, as well as some of those community centers also have fitness programs like yoga or just dance and weights. So it's pretty neat just to keep yourself active and out there and socialized. Let's go to preventive service. Colorectal cancer screenings. Medicare covers these screenings to help find precancerous growth or find cancer early when treatment is most effective. Medicare may cover one or more of these screening tests. Computed I can't even pronounce it. Tomography, colonoscopy. I'm so bad at medical terms. Okay. Medicare covers these screening tests once every 24 months if you're 45 or older and at a high risk for colorectal cancer. If you aren't at high risk, Medicare covers the test once every 60 months or 48 months after a previous sigmoidoscopy or colonoscopy. You pay nothing if your doctor or healthcare provider accepts assignments. So definitely, I'm actually just turned 45 and I am actually going to get a colonoscopy because I guess it's the age, right? And my husband, he's older than me, he elected to just do this, the sample that you mail. So different strokes for different folks, but I rather just get it done, make sure I'm good for another, I don't know, 5 or 10 years or however that is. But obviously, once you're older, it's probably more. Okay, so screening colonoscopies. Medicare covers a screening test once every 120 months or every 24 months if you're at high risk, or 48 months after a previous flexible sigmoidoscopy. Okay, just can't pronounce these terminology. Okay, terms. There's no minimum age requirement. If you initially have a non-invasive stool-based screening test, fecal occult blood test, or multi-target stool DNA test, and receive a positive result. Medicare also covers a follow-up colonoscopy as a screening test. You pay nothing for the screening test if your doctor or other qualified healthcare provider accepts assignment. Find out what Medicare covers. Flexible sigmoidoscopies. Medicare covers this test once every 48 months if you're 45 or older, or 120 months after a previous screening colonoscopy if you aren't at high risk. So what is that? That's 5 years. You pay nothing for the test if your doctor or other qualified healthcare provider accepts assignments. I would say you really do need to advocate for yourself. So if you feel like you need it with less than 5 years, I would definitely ask your doctor and advocate for yourself, right? If your doctor finds and removes a polyp or other tissue during the colonoscopy or flexible sigmoidoscopy, you pay 15% of the Medicare approved amount for your doctor's services. In a hospital outpatient setting, you also pay a 50% coinsurance. The Part B deductible doesn't apply. So keep in mind, this is for original Medicare supplement, right? And Medicare. And then if you get a supplement, should be paid. And if you get a Medicare Advantage, you just need to get it approved. Fecal occult blood test. Medicare covers a screening test once every 12 months if you're 45 or older. You pay nothing for the test if your doctor or other qualified health provider accepts assignment. So keep in mind, just accepts assignment, right? And just, make sure to run it through your doctor. Multi-target stool DNA and blood-based biomarker test. Medicare covers these screening tests once every 3 years if you meet all these conditions. You're between 45 to 85. You show no symptoms of colorectal disease, including but not limited to lower gastrointestinal pain, blood and stool, a positive GUA-LAC fecal occult blood test, or fecal immunochemical test. You're at average risk for developing colorectal cancer, meaning you have no personal history of edematous polyps, colorectal cancer, or inflammatory bowel disease, including Crohn's disease and ulcerative colitis. You have no family history of colorectal cancer or edematous polyps, familiar edematous polypsis, or hereditary non-polyposis colorectal cancer. Sorry if I butchered that. Multi-target stool DNA tests are at-home lab tests. Blood-based biomarker tests are conducted in a lab. You pay nothing for a test if your doctor or other qualified health care provider accepts assignment. Continuous positive airway pressure, CPAP devices and accessories. Medicare may cover a 3-month trial of CPAP devices and accessories if you've been diagnosed with obstructive sleep apnea. After the trial period, Medicare may continue to cover CPAP devices and accessories. If you meet with your doctor in person and your doctor documents in your medical record that you meet certain conditions and the CPAP is helping you. You pay 20% of the Medicare approved amount for the machine rental and purchase of related supplies like mask and tubing. The Part B deductible applies. Medicare pays the supplier to rent the machine for 13 months if you've been using it without interruption. After you rented the machine for 13 months, you'll own it. Note, Medicare may cover a rental or replacement CPAP machine and or CPAP accessories if you had a CPAP machine before you got Medicare and you meet certain requirements. So this may be a bigger deal if you have an Advantage plan, because sometimes if you move from one Medicare Advantage plan to another, the vendors might not be the same. Maybe you're renting it, so you have to give it back, or maybe it's after the 13 months, right? But make sure to call the carrier or your agent to get you this information so you don't have any disruption of care. Preventive service. Counseling to prevent tobacco use and tobacco-caused disease. Medicare covers up to 8 face-to-face visits in a 12-month period if you use tobacco. You pay nothing for the counseling sessions if your doctor or other qualified health provider accepts assignment. COVID-19, coronavirus disease 2019. Many people with Medicare are at higher risk for serious COVID-19 illness, so it's important to take the necessary steps to keep yourself and others safe. Medicare covers several tests, items, and services related to COVID-19. Talk with your doctor or healthcare provider to find out which are right for you. COVID-19 vaccines. FDA approved and FDA authorized vaccines help reduce the risk of illness from COVID-19 by working with the body's natural defenses to safely develop immunity protection against the virus. You pay nothing for the COVID-19 vaccine if your doctor or other qualified healthcare provider accepts assignment for giving you the shot. Be sure to bring your red, white, and blue Medicare card and when you get the vaccine so your healthcare provider or pharmacy can bill Medicare. If you're in a Medicare Advantage plan, you must use a card from your plan to get your Medicare covered services. You may pay nothing when you get the vaccine from an in-network provider. Check your plan for more information. So if you are on original Medicare, bring that red, white, and blue card as well as your supplemental plan, your Medigap plan ID card. If you have the Medicare Advantage plan, bring that in. Biggest thing is, use it in network or provider, contact the carrier or your agent. Diagnostic laboratory tests. These tests check to see if you have COVID-19. You pay nothing when a healthcare provider orders this test, and you get it from a laboratory, pharmacy, doctor, or hospital that takes Medicare. If you're in a Medicare Advantage plan, check with your plan to find out if you have any out-of-pocket costs. Monoclonal antibody treatments and products. These FDA authorized or approved treatments can help fight the disease and keep you out of the hospital. You may test positive for COVID-19, have mild to moderate symptoms, and be at high risk for progressing to severe COVID-19 and or needing hospitalization. Original Medicare will cover monoclonal antibody treatments if you have COVID-19 symptoms. You pay nothing for these treatments. When you get them from a Medicare provider or supplier, you must meet certain conditions to qualify. If you are in a Medicare Advantage plan, check with your plan about your coverage and costs. Note, certain FDA authorized or approved monoclonal antibody products can protect you before you're exposed to COVID-19. If you have Part B and your doctor decides this type of product could work for you, like if you have a weakened immune system, you pay nothing for the product when you get it from a Medicare provider or supplier. Let's go to page 38. get more information, learn about these covered services at medicare.gov/medicare-coronavirus. For more on COVID-19, visit cdc.gov/COVID. Defibrillators. Medicare may cover an implantable cardioverter defibrillator if you've been diagnosed with heart failure. If the surgery takes place in an outpatient setting, you pay 20% of the Medicare approved amount for your doctor's services. You also pay a copayment. In most cases, a copayment can't be more than Part A hospital stay deductible. The Part B deductible applies. Part A covers surgeries to implant defibrillators in an inpatient hospital setting. Go to inpatient hospital care on pages 27 to 28. Okay. So preventive service for depression screening. Medicare covers one depression screening per year. The screening must be done in a primary care setting like a doctor's office that could provide follow-up treatments and or referrals. You pay nothing for the screening if your doctor accepts assignment. If you are someone you know is struggling or in crisis and would like to talk to a trained crisis counselor, call or text 988, the free and confidential suicide and crisis lifeline. You could also connect with a counselor through web chat at 988lifeline.org. Diabetes equipment, supplies, and therapeutic shoes. So this is a popular one. Medicare covers meters and continuous glucose monitors used to estimate your blood sugar level, and related supplies, including test strips, lancet holders, sensors, and control solutions. Medicare also covers tubing, insertion sets, and insulin for patient using insulin pumps and sensors, transmitters and receivers for patients using continuous glucose monitors. In addition, Medicare covers one pair of extra def or custom shoes and inserts per year for people with specific diabetes-related foot problems. You pay 20% of the Medicare approved amount if your supplier accepts assignment. The Part B deductible applies. Important, Medicare drug coverage Part D may cover insulin you inject yourself, certain medical supplies used to inject insulin like syringes, disposable pumps, and some oral diabetes drugs. Check with your plan for more information. The cost of 1 month's supply of each covered insulin product is capped at $35. Go to page 88. Similar caps costs on apply for traditional insulin use in Part B covered insulin pumps. So I would say like this is a big one, right? Like Ozempic, you do need your doctor's approval for that, but most plans do cover it under Part D. I'd also say for the diabetic supplies, there are companies out there that actually could take care of all of your supplies from A to Z, and you might not even pay anything, because sometimes when you do use your Medicare Advantage plan, there are specific brands that plan only takes. So sometimes it's nice to use a diabetic company. If you wanted information on that, just let me know, and I could give that to you, because it's just easier going through one vendor that specializes in that. And most things, I mean, if they send it out, it'll be free, or they, will let you know if there's a cost to it. So let's go preventive services, diabetic screenings. Medicare does cover up to 2 glucose blood sugar laboratory test screenings, fasting or non-fasting. Each year, if your doctor determines you're at risk for developing diabetes, you pay nothing for the test if your doctor or other qualified healthcare provider accepts assignments. So that is it for today. We will continue on section 2, find out what Medicare covers under the diabetes self-management training, page 39. Till next time, I will see you next week. Have a wonderful day.